Today our topic is kidney transplantation. Here we are going to see about the definition of terms, history, graft rejection, immunosuppression, transplant evolution, transplantation, transplant complication and the organ donation. Definition of terms. For the transplantation, the process of transferring an organ or the tissue or cell from the one place to another. Organ transplantation, this is a surgical procedure in which a foreign organ is replaced by the functioning one. According to the location, we have classified our transplantation into many types. One among them is orthotrophic, implanted to the same anatomic location in the recipient as it was in the donor. Heterotrophic, implanted in the different anatomic position. According to the immunological classification, the transplantation is classified into many types like autotransplant, transfer of an organ or the cell or the body tissue a different location of the same person. Allotransplant, transfer of an organ or the cell or the body part of one person to another of the same species. Allograft, different person within the species. Isograft, they have the identical twins. Xenotransplant, transfer of an organ, cell or the body part from one organism to another of the different species. In 1968, PGH, 1969, UST, 1983, NKTI, 1985, LOD. This is nothing but the living related donor. In 1988, NKTI and 1990, NKTI with bone marrow. In 1994, MMC. 2000, DDNKTI. 2001, peripheral blood stem cell transplant. In 2014, ALD PGH. DD is nothing but the decreased donor and A is the adult and P is the pediatric here. Rejection. Host response against the graft. They are triggered by the T cells cellular rejection and the B cells humoral rejection. Hyperacute, they occurs immediately. Accelerated acute within the first few days. Acute rejection occurs within 6 months. Chronic rejection greater than 6 months to years. Indication, KT with the decreased donor regardless of the HLA cross match. KT with the living donor unless the zero mismatch or the identical twins. Presence of DSA, donor specific antibody. Prior transplantation, 2 HLA DR mismatch, PRA of 20%. Rejection, the host response against the graft, they are triggered by T cells as I said before. Depleting antibodies, rapid anti-thymocyte thymoglobulin or RATG. They depletes all the peripheral lymphocytes T and B cells. The side effects like they causes the cytokine release the hormone and they release the syndrome. Non-depleting antibodies, Basilicsan, anti-CD25 monoclonal antibody, IL-2 suppressant. Competitively, they binds to the IL-2. Immunosuppressant, the maintenance will be given a detailed structure of a squats 11th edition and the goal is to maintain a balanced immunosupport and the suppression they develop the tolerance. Corticosteroids, calcineurin inhibitors like cyclosporin and the tacrolimus, antimetabolites like mycophenolate mifepristone, mycophenolate sodium. Proliferation is in the signal inhibitors like sirolimus and everolimus. Transplant evolution, like in the recipient they are the living donor and in the recipient they also have the decreased donor also. Absolute contraindication like positive tissue crossmatch, presence of serious active infection, presence of active malignancy, poorly defined financial resources for the maintenance of medical, severe uncontrollable cardiovascular disease, end-stage liver disease, severe restrictive lung disease, O2 requiring disease, pregnant women, very poor functional capacity. Any condition with a life expectancy of less than 2 years, HIV positivity, history of a non-compliance to meds, history of a drug abuse, history of the irreversible psychiatric illness. For donating, the contradiction is age is lesser than 18 years, severe cognitive deficit, inadequately treated psychiatric disease, use of the prohibited drugs, alcohol abuse, evidence of the renal disease, significantly abnormal renal anatomy, recurrent nephrolithiasis, bilateral stones, cardiovascular disease, moderate to the severe pulmonary disease, DM or impaired glucose, collagen vascular disease, HPN, BP 130/90, any form of the malignancy, and familial history of the renal cancer cell, chronic active viral infection, active HIV, significant chronic liver disease, significant neurologic disease, disorders requiring the anticoagulation, history of the thrombotic disease, and they also have the severe obesity, BMI is greater than 35. What is the difference between the cardiac death, brain death, and the death itself? Yes, none. The perfusion, the distal artery clamps are removed first. Donor renal vein should fill rapidly before the venous clamps are removed. It is important to ensure all clamps are removed. The recipient has good BP. There is no minimal dissection of the proximal recipient artery or the donor artery. Cerevo, the wound infection, bulging, surgical site, fluid collection in the subcutaneous tissue or the complex area of the abscess. They also cause the drainage, culture and sensitivity, and also in the antibiotics. Perinephric abscess, they cause pain, fever and sepsis. Complex mass, drainage, the culture and the sensitivity antibiotics. Hypocosis, if it is lesser than 3 cm clinically insignificant, occurs 2 to 4 weeks post KT, may present as the deteriorating graft function with the perigraft swelling and the leg edema. Round, sonolucent, separated mass. Drainage with fluid analysis, repeated aspiration, sclerosing agents, betadine tetracycline, fibrin glue, and the peritoneal window. Organ donation versus organ trafficking. Organ and the tissue donation, like the blood donation, is expected to be truly altruistic and the voluntary act. No expectations of the monetary gains and free from the undue enticement. RA 7170 as amended by RA 7885, Organ Donation Act of 1991. DOH AO number 2010-0018. Payment as precondition for the kidney donation and sale and purchase of the kidney are prohibited. Transplantation is not the part of the medical tourism. Foreigners are not eligible to receive the organs from the Filipino living non-related donors, both from living and the deceased one. Non-directed L and RD are not allowed to donate the organs. No kidney or organ be transported or exported for the transplantation abroad. Thank you.